Cardiac babies face many nutrition challenges. They have a high metabolic demand depending on the type of lesion and sometimes require 120% or more of your typical recommended energy and protein needs. Because of this high metabolic demand, that leads to an inadequacy of energy and protein intake. We see commonly acute malnutrition, especially in our acyanotic lesions, as well as chronic malnutrition in the cyanotic lesions and many growth disturbances. Cardiac babies face many feeding challenges, and they vary depending on the phase that the patient is in. Preoperatively, cardiac babies need to establish cardiac stability prior to initiating TPN, so often feeding is delayed. We see many babies become diaphoretic or tachypnic, so they're breathing really fast and they're not able to actually coordinate their suck, swallow, breathe, and therefore limiting their intake. So commonly, preoperatively, cardiac babies require some form of supplemental nutrition. Many centers do not like to force feed these cardiac babies. And so if they do start trophic feeds, they usually don't get much past trophic feeds, whether it be by bottle or by tube. And many end up on supplemental parenteral nutrition. Postoperatively, cardiac babies face different challenges, feeding challenges. We see fluid restriction severely within the first 3 days postoperatively. We commonly have a combination of parenteral nutrition as well as enteral nutrition. Post-cardiac surgery, feeding challenges include swallowing dysfunction. Some of these babies after surgery require high respiratory support, and so we are unable to progress them orally, as well as sometimes during specific types of surgeries, corrective surgeries, some of these babies have vocal cord dysfunction or injury to the laryngeal nerve, which we have a high incidence of aspiration. So swallowing dysfunction is a very common feeding challenge that we have in our cardiac babies. We see frequent emesis with feeding, as well as if we try to adjust the volume or fortification. So many of our babies tend to require some type of anti-reflux or pro-motility agent. We also see motility issues as well. Babies sometimes have slower digestion after surgery, and therefore we need to help them with a motility agent.